Very good evening, friends. Meeting again in the session of Materia Medica. And today we're going to learn one remedy, generally not so commonly utilized in our practice, but very useful in our practice, specifically in brain complaints, hysterical complaints, and that is Moschus. Very short acting remedy like opium. One day action is there with the Moschus. It is musk. This remedy has a very typical features. I will going to share you one case. In fact, there are very less cases with me of this specific remedy. But this case was interesting. It was in around 2000. A 40 years businessman who came to me, known diabetic, and on his look, mm, on just on looking towards him, looks to be a little bit hysterical because of his the way he moves, the way he walks, everything, and suffering from since last 2 3 years, where diabetes from 5 years, and 2 3 years he was having vertigo which was not getting cured. So I took the whole history, and history was interesting. Basically, chief complaint was very important, that vertigo, whenever the patient moves slightly, it comes used to come immediately after motion, and it is as if he will going to fall down. Whenever he used to stoops, the vertigo gets aggravated, and when he used to come up, rising up, his vertigo gets ameliorated. That was interesting, very specific with this fellow. Then he explained that, doctor, whenever I get this vertigo, I feel I will fall down, and all of a sudden I become dull. Many doctors have explained that this might be a petit mal epilepsy, what you are getting. It might be a convulsion or fit, but they were not coming to the conclusion. He was having diabetes since 5 years, which was controlled, but still having a lot of features. Specifically, he is having the profuse urination day and night. Second important thing, which was important complaint for him, that doctor, I have an impotence. He had tremendous sexual desire. And he said one interesting thing, that doctor, whenever I get attack of vertigo, all of a sudden I start getting sexual desire. It gets increased. But whenever I used to go for coition, the impotency comes. Then the erection gets disturbed. And he was looking like an old man. He was even in 40, he was looking like 50. So that was the case. When looking towards the modalities of vertigo, sometimes it comes to my mind, it might be a sulfur, or it might be a cona immaculatum, etc. Premature senility is there. But when I opened the repertory and looked towards the rubrics, there was one important rubric was there. Dullness as if falling from height. Single remedy, the Moschus was there, 1 mark. Then second rubric was there, vertigo rising from stooping ameliorates. Again, rising from stooping ameliorates. Single remedy given as a Moschus in complete repertory. Third rubric was vertigo stooping aggravates, 2 marks. Vertigo falls from height as if, that is another rubric where Moschus was given for 2 marks. Then there was, interestingly, I opened the male genitalia chapter to look towards the symptoms. Is there any relation with vertigo with the sexual desire? And there was a rubric, sexual desire, libido, desire increased, vertigo after. And again, 2 marks remedy was Moschus. So it was very clear-cut case of Moschus. Then there was one more feature which I have told, that he was looking premature senility, old looking personality. That was the another feature. Then he's looking a hysterical man. That was another. Then in physical generals, only two important features: that he used to crave a coffee a lot since last 10 years. Or if it is not available, he wants some stimulants every time. And that was the case. So Moschus was very clear. So I have decided to start him on the Moschus. A medium potency, I have selected Moschus 200. I have given 3 doses, asked him to meet me 3 doses on day 1, 3 doses on day 2, and asked him to meet me after a week. After giving Moschus, within span of 10 days, gradually his vertigo disappeared. He felt better that that modality, whenever he used to stoop, there was vertigo, or he was finding it out difficult, he was considering that he will fall from height. Those features disappeared. Second important thing, his profuse urination was in control, specifically at night. That was another feature. There was no change with the impotency. So I have increased the potency 200 to 1 Moschus, and 3 doses were given. I asked him to meet me after a month. When he returned after a month, he was in a very good mood. Basically, the purpose has been solved with the help of Moschus. Diabetes with impotency. This is one important remedy other than acid first. And acid first, it is diabetes with debility more marked with impotency. Here it is more impotency. So Moschus worked beautifully in that case, and he recovered. I have continued him on nearly about for 6 months, and he was absolutely recovered from it. He started doing exercises, he started following the diet, and his cravings for coffee and stimulant that has reduced, and because of which he recovered so nicely. So that it is a very interesting remedy in our Materia Medica, which is not mentioned in Allen's keynotes. So today we're going to discuss it from Borik's Materia Medica, the Moschus, the MERS. A remedy for hysteria and nervous paroxysms. It's very important. A remedy for hysteria. The first sentence. The globus hystericus is there with this remedy, like asafoetida, like valeriana. This is one more remedy, or Rapanus is one more remedy, where these hysterical features are quite common. Moschus is one of them. A remedy for nervous and hysteria and nervous paroxysms, fainting fits, and convulsions and catalepsy. So this is very important, that this is the remedy for brain affections, the nervous affections, the mental affections. The characteristic condition being aggravated by cold, and this is underlined this is very important. There is also very important feature, that impotency from cold. That is where the Moschus is mentioned in the repertory. The characteristic condition being aggravated by cold, there is great sensitiveness to air, much nervous trembling, and frequent fainting. So there is frequent fainting. It is as if petit mal. Many times they falls down. Great flatulence. This is globus hystericus. Diseases do not follow normal course. Coldness, tension in the muscles, skin, and mind. So this paragraph itself suggests that the site of action of the remedy. Mind, uncontrollable laughter. It is like cannabis indica. If person used to take that cannabis, he used to go for laughter and he cannot control it. Similarly, it happens with this remedy. Scolding, anxiety with palpitation, starting from frightened, sexual hypochondriasis. That is another feature. They dwells on it, and they are very much disturbed at the sexual level. Head, the compressive pain over the root of nose. This is the site where there is a compressive pain, like calivicromicum. It is very close to calivicromicum. Pressure on the top of head, vertigo on least motions. Underline this, vertigo is very characteristic in this remedy. In fact, if you open the repertory, you will find many symptoms under the Moschus for vertigo. Vertigo on least motion, Vertigo with sensation as if falling from a great height. That is very important feature of this remedy. The scalp is too sensitive. Sounds in the ears as from the retort of a cannon. Retort means pratidhvani, a reflection of the sound. And that type of sounds there are in Moschus remedy. Stomach, there is a desire for black coffee, very specific black coffee, the stimulants, many times tea. This is characteristic of Moschus. Aversion to food. They like tea, coffee, all those stimulants, but there is aversion to food. Everything tastes flat. Whatever they eat, their taste is not good over there. With stomach complaints, anxiety in the chest, anxiety felt in stomach, that is kali carbonicum. Here, anxiety is in chest, distended. The stomach is distended, faints when eating. Patient faints whenever he is eating. Abdomen greatly distended, spasmodic nervous hiccup. This is again one important remedy where the nervous hiccup is there. Other than hydrocyanuric acid, sulfuric acid, ignatia, cajapitum, that is another remedy for the hiccup. See the male genital features. They are very important. Violent desire, involuntary emissions of semen, impotency associated with diabetes like coca. This feature is very characteristic. Impotency with diabetes, with debility, think of phosphoric acid. Premature senility. See the word premature senility. This is very, very important feature of this remedy. They looks very prematurely senile. Nausea and vomiting after the coition. Again, characteristic feature. After the coition, there is nausea and vomiting. Female, menses too early, too profuse, with disposition to faint. So patient used to faint during the menses, and there are profuse menses like nux moschata, like veratrum. Veratrum, it is vertigo, or many times in veratrum album there is a vomiting or diarrhea. The cholera-like symptoms are present during or at the start of menses in veratrum. Sexual desire with intolerable titillating in the parts. So irritation in the sexual parts, and there is increased sexual desire in female. Drawing and pushing in the direction of genitals, sensation as if menses would appear. So there is always the sensation that menses will come and this will come, and there is irritation in the specifically at genital area in this Moschus. This is sensitive at the sexual sphere, both in males as well as in females. But in males, it is the impotency when he attempts. In case of females, it is increased desire or irritation at the part. That is very important. Urine, profuse urination, diabetes. So very important remedy for diabetes patients. Respiratory tightness of chest is obliged to take a deeper breath. Sudden constriction of larynx and trachea. The larynx and trachea gets constricted over there. Difficult respiration. The respiration is difficult. Chest is oppressed. Breathlessness. This is more commonly towards a hysterical feature. They look hysterical. They feel that there is blocking in the chest. There is distress, and they feel there is palpitation, and they goes in that phase. More commonly functional in origin, more commonly like looks like ignatia, the hysterical breathlessness, hysterical convulsion. This is one more remedy. Hysterical spasm of the chest, asthma. So hysterical asthma, hysterical epilepsy, more commonly you can go with the ignatia, but here it is hysterical asthma more commonly present. Spasms of glottis. The glottis, there you'll get a spasm, and patient is showing typical features, a sound which is produced over there. Impending paralysis of the lung. Impending means hoऊ घातलेला. It is as if it will going to enter into that. Asthma with intense anxiety. There is tremendous asthma with tremendous anxiety, fear. and smothering sensation. So there is absolutely smothering sensation, blocked sensation, as if something is congested over there. The cup seizes, mucus cannot be expectorated. Cup stops, but there is mucus which is get obstructed and not coming out. Globus hystericus. Patient talks, whenever globus hystericus is there, patient talks in one specific sentence. Doctor, I'm having very much problem over here. Sometimes it happens that my upper breath remains over there and lower breath remains over there. माझा वरचा श्वास वर आणि खालचा श्वास खाली असं राहतो. That is very typical presentation with the globus hystericus. They always talks in this sense. So you must think, you must catch the patient's presentations in that specific condition. What patient talks? Hindi, if you'll discuss it in Hindi, the patient talks in like that doctor मेरी ऊपर की सांस ऊपर रह जाती, नीचे की सांस नीचे रह जाती, मैं सांस ही नहीं ले सकता, इतना इतना कुछ फील करता हूँ, बहुत डेंजर रहता है. That is very typical features. These features are very interesting of the Moschus. So you have to understand these features exactly, that what patient talks, the way patient narrates. So this is globus hystericus. Heart hysterical palpitation. Very important. So Moschus is having this hysterical palpitation, the hysterical asthma, the hysterical epilepsy. There is a vertigo falling from sensation as if falling from height. Heart is hysterical palpitation, trembling around the heart. So the tremors feel around the heart. There is weak pulse with and fainting. So this fainting is because it is a hysterical spasm, hysterical fainting, and patient goes into shock sometimes because of that. Modality is better in open air and rubbing, like pulsatilla. Patient feels better in open air. Patient feels better by rubbing, worse by cold. This is strong modality of Moschus. They are absolutely chilly remedy. The open air is felt very, very cold. So if open cold air, patient gets aggravated. Relationship, compare Nux moschata, the Asafoetida, all hysterical remedies, Nux moschata, Asafoetida, Valeriana, the Sambul, Ignatia, and Castor equina. Compatible, Ambra grigia. Antidotes are camphor and coffee. Action is only 1 day, and dose is first to third potency as defined by Boric, but generally 30 to 101 mg. These are good potency according to the situation you can use. So Moschus generally overlooked, or many times we miss, many times we select Ignatia instead of Moschus. Many times we select another hysterical remedy, but we generally forget Moschus. But Moschus has typical features. My suggestion to open the repertory and find it out where Moschus is mentioned for the vertigo and where Moschus is mentioned for convulsions. You will get ample symptoms related with it. So if you will go through the repertory, you will understand Moschus in a better manner than anything else. So this is what Boric has mentioned regarding the Moschus. So learn this remedy again from different sources, and you learn and acknowledge, and you can use it in your practice. So that's all for today. Tomorrow we'll meet with another remedy and at the same time. Any queries there, we'll have a discussion, otherwise we'll conclude. So good night, and we'll meet tomorrow for both the sections.